Good evening, everyone. I am Dr. Muskana Lawal from Team Voice of Healthcare, and a very warm welcome to our esteemed speaker, our moderator, and participants for joining us today for this insightful virtual panel discussion on Escalate safety and quality in your lab, from good to excellent. We are truly delighted to have all of you with us as we bring together experts to share perspectives, experience, and some actionable insights on strengthening quality and safety in laboratory practices. Before we begin, I would like to briefly introduce Nivara Healthcare Improvement. Nivara is a quality improvement consultancy dedicated to making healthcare safer, smarter, and more patient centered. They work closely with healthcare providers to build resilient systems, reduce preventable harm, and elevate standards of care across the ecosystem. I would also like to take a moment to introduce Voice of Healthcare. Voice of Healthcare is a dynamic platform dedicated to make healthcare priority of all. We bring together diverse stakeholders to foster collaborations, dialogue, and innovation across the healthcare ecosystem. As an impact driven platform, VOH amplifies ideas, voices, and policy conversations, shaping the future of care. Through expert led discussions, knowledge sharing, VOH continues to drive healthcare better to access, delivery, and outcomes as well. Moving onwards, it's my pleasure to introduce our speaker, Dr. Manisha Khurana, Editor in Chief at Voice of Healthcare and founder of NextGen Precision Medicine Insights. Dr. Manisha is a highly accomplished pathologist with over 22 years of experience in diagnostic pathology, with strong expertise in quality assurance, laboratory operations, and process improvement. She is also a creator, innovator, and educator, actively contributing to advancing healthcare through collaboration and knowledge sharing. Known for her leadership rooted in open communication and mentorship, she continues to drive excellence within the healthcare system. Welcome, ma'am.
Thank you. Thank you so much.
Moving onwards, it's my pleasure and privilege to introduce our moderator for today's session, Dr. Mahtab Singh, a highly respected name in public health and healthcare quality improvement. Dr. Mahtab is a founder member of Nivara Healthcare Improvement LLP, where he leads operation and management, and has also been a key force behind the nationwide quality of care network, having served as its former vice president. With over 30 years of experience in public health, he has been deeply involved in designing and implementing large scale health programs, working closely with government stakeholders at both state and national level. His expertise span disaster and health emergency preparedness, vaccination systems, disease surveillance, field epidemiology, and strengthening monitoring and evaluation frameworks for public health programs. He has also contributed extensively to the field through multiple publications in peer reviewed journals. Welcome, Dr. Mehtab, to our platform.
So much, Dr. Muskan.
With that, I would like to hand over the session to our moderator, Dr. Mehtab, to take the discussion forwards. Over to you, sir.
Thank you very much, Muskan, for a nice introduction and a very happy afternoon, Dr. Manisha, and to all the participants.
Thank you.
So, before I think to hand over to Dr. Manisha, our respectable speaker today, I think let me put up a couple of points about today's this live session on labs work. We picked this topic because the lab work is key to, I think, all the departments in a healthcare facility or system to maintain sterility, or to guide people how to do clean work, right work, and the safe work for for the healthcare providers as well as to the patients. So friends, you all have learned through Dr. Muskan about our speaker today. She has extensive experience of working in a lab. So to make this session or conduct this session in a smooth way, let me put forward a couple of requests to you. The first is if somebody has any query or question, please be informed that we have a session on questions and answer at the end of the presentation by Dr. Manisha. But if you still feel, putting your queries or question in between the presentation, you're most welcome. But try to put in the chat box or the comment box, or you can raise your hands. Our team, backend team, would uh, unmute you, and you can speak or say whatever you want to say. So I think with these words, I will not take much of the time. Most important is learning from our worthy speaker, Dr. Manisha Khurana. Over to you, ma'am.
Thank you. Thank you, Dr. Mahtab. And back in team, can I have my presentation? All right. So, as has been briefed by Dr. Mehtab, today's discussion is about the medical laboratories executing biosafety and how to, handle the infectious material. Because it is not only for the personnel working in the laboratory that is mandatory and that is required for safe environment. It is also for the quality of the work which that personnel is doing, and ultimately leading to a patient, trust in the laboratory and diagnostic services. Since we know that the diagnostic is a part of hospital work as well, and it is through the diagnostic work most of their hospital acquired infections are there. But if we have the biosafety policy as well as the workflow in place, we can definitely address those infections, and we can train the personnel to, follow the good laboratory practices in the daily workflow to combat such hospital-acquired infections. And that is why we can always enhance our quality in the lab as well as the safety, not only for the personal working but also for the patient to have the right treatment with the data driven, quality driven reports. And also once the samples are processed and they are discarded in the environment, then environment should also be protected. So let us take a look of how this is done in a laboratory. So, as I told you, my objective is to make you understand that how biosafety framework works, and specifically, I'll be, talking about the biosafety level 2 laboratories, the microbiology laboratories here in this presentation, and what are the safe practices that has, evolved from the universal precautions which we have to take in the laboratory. And these are the routine mandatory safe practices which must be followed by the personnel to have the safety for himself and for the patient and for the environment. Along with that, I also try to integrate biosafety with the quality work in the laboratory. So let's first understand that how WHO defines biosafety. Biosafety is something which has been defined by WHO through risk assessment. So what is risk assessment? Risk assessment is something which is dependent on that how probable a particular incident can occur and how severe it is. In this case, in case of biosafety, it is the pathogen that is the most important. And if a pathogen can lead to more infections, that is more probability of getting the infection, and more severe one, that means it is more in the biosafety level framework. And that is why the biosafety has been divided into 1, 2, 3, 4. To have a proper control and containment of biosafety, we must follow certain standard practices in the laboratory. We should have certain engineering and control and containment, which starts with a basic biosafety cabinet, and we should have the personnel who is performing the test. That person should be well trained, and if that person is not performing the test properly, there would definitely be cross contamination of the samples and would be leading to infection for himself as well as for the patients. So let's try to understand that what is biosafety level 2, risk-based biosafety. So biosafety level 2 addresses the organism that has got, the treatment available if at all the disease occurs. You can take the precautions to not to have the disease, and also it depends on the risk-based biosafety depends on the procedure which is being performed by the personnel. If the personnel is involved in the procedures that can lead to aerosol formation, definitely that would be leading to more chances of having the infection. So the probability of having the infection would increase. And also everything depends on the behavior and the competency of the personnel. If the person is not well trained, the cross contamination can occur, and definitely whatever we may have in the laboratory in terms of, say, infrastructure, biosafety cabinet, if the personnel is not trained, then that can also lead to hazardous leak of the pathogens into the environment and into the workflow as well. So biosafety levels have been, divided into 1, 2, 3, and 4, and it is a risk-based approach, as have told you. It depends on the pathogen which is involved. If the pathogen is of moderate degree, that means if the pathogen is not airborne, it cannot be transferred through air transmission, then it is a biosafety level 2. Why it is moderate? Because we have the treatment available, we can take the precautions, we can have the vaccines available, and also we can have certain good practices like the personal protective equipments, the basic ones, maybe the gloves or the lab coat, and we have certain control available in the form of biosafety cabinets, and we can definitely contain this kind of infection. But on the one spectrum of this, we have the biosafety level 1, which is not that dangerous. It cannot spread much. It is low risk. So definitely the containment would also decrease in such cases. And on the other end of the spectrum, we have the biosafety level 4, where we have the full suit we have to wear, and we have to have much more containment level in such cases. So what is the scope of biosafety level 2 medical laboratories? These are going to, deal with hepatitis B, HIV, salmonella typhi. These are the common tests which are performed in any medical laboratories. And, they are going to be there in the samples, and we will treat that sample if the diagnosis is not as it being a positive, and we'll take all the universal precautions to contain it. So these are the common pathogens, and we have the post exposure prophylaxis available. We have the vaccines available if at all the leak occurs, and we can take the required precautions. So, in case of biosafety level 2 laboratories, what is the best, what we can do is we can have a biosafety cabinet, installed, and that biosafety cabinet would be of type A2. It is not only going to, protect the personnel, it is going to protect the sample, and it is going to protect the environment as well. How environment? Because it has got the HEPA filters fitted in it, and whenever the air it goes out, it will definitely be cleaned before pushing it into the environment. And how it is going to protect the personnel as well as the sample? It is because of the kind of airflow and the air curtain it forms, and that is why we have the personnel who is performing the test also safe. We have the samples also safe, because the aerosol, if at all it occurs, like if somebody is inoculating a culture plate, or if it is pipetting, then in that case it will protect the personnel as well. So what are standard microbiology practices which everyone should follow while doing this, microbiology work in any medical laboratory? It starts with a simple technique of hand hygiene. You can always wash your hands with soap and water. And this is to be remembered here, that even if you're wearing the gloves and you're, taking off your gloves, please do wash your hands after taking off your gloves, because there's a common mistake. Everyone doesn't realize that after taking out the gloves, we have to wash our hands. Do not eat anything. Do not mouth pipette. Use appropriate personal protective equipment. Here I want to emphasize that personal protective equipment is flexible here. It depends on the kind of exposure the person is having and the kind of work the person is doing. If somebody is doing, say, work which has got the aerosol production or dealing with the pathogen which has the air transmission, we should definitely use the N95 mask. Similarly, if there is a exposure to eye, we should use goggles. If we have routine work doing, then we can use the lab coat and the gloves. That's all what is needed. Restricted access labs should not be entered by the personnel who is not required. Only the authorized person should enter the laboratory. And the routine disinfection. What is routine disinfection? That means it starts from our workbench and the equipments which we are using. The surface, they are prone to having a biofilm formation of the pathogens which we are dealing with. We should have the cleaning in place daily. That can be done with a simple 1% hypochlorite. Once the waste is generated after performing the daily's work, that waste could be a source of infection. So it is required that that waste should be segregated at the source, and it should also be disinfected before before giving it to the biomedical waste agency or discarding it. So how can it be done? The segregation we have the color coding system. We should know that any infectious waste that has to be, segregated into yellow color coded dustbin. Anything which is plastic and which is recyclable has to be discarded in red. And we have to be very, very stringent about sharp waste. These are to be discarded in punch-proof, a transparent box, and that should immediately be done. No recapping should be allowed, and because that can lead to direct inoculation of the pathogen into the bloodstream. So we should be very, very vigilant while dealing with the sharp. Then the glassware which you produce, say the slides or the tubes, that has to be discarded in the blue box. Here, what are the most important disposal rule? That any liquid waste which is generated, that has to be, discarded in the drain, but it should be chemically treated first, right? It has to be treated with 1% hypochlorite. Any sharp, as I told you, should not be recapped, immediately disposed, because that can lead to direct inoculation of bloodborne infections like HIV, hepatitis B, hepatitis C virus, and also whatever the microbiological waste are being generated, like the culture plate, etc., that has to be autoclaved. That is mandatory, because that will lead to, because it's a culture, so it has got the pathogen. That pathogen has to be disinfected by autoclaving before discarding it into the yellow color coded dustbin. So autoclaving, that is why it becomes the integral part of our workflow in the microbiology laboratory if we are dealing with the culture place and the pathogen on daily basis. So what autoclaving does is going to kill all the bacteria, even the spores, with the help of steam, that is a moist heat which is generated, and it has got certain physical parameters that has to be taken into consideration every time the autoclaving is done. The temperature should be all right. It should be 121 degrees C, and the pressure should be okay, like the 15 psi, and the autoclaving cycle should be of 15 to 30 minutes. So these are the physical indicators which we must take into consideration while doing the autoclaving. Also, we have certain chemical indicators and we have certain biological indicators that whatever we are autoclaving, that is killing actually the bacteria and doing the required sterilization and disinfection of the waste. So all these should be documented, because whenever the accreditation or audit is done, what is documented is actually done. That is what is believed. If we don't document, that means that thing is not done. So autoclaving cycle and the required monitoring and validation of the procedures, we have to document it, and that will not only save the personnel, the workflow, the quality of the lab, the waste disposal, and the environment as well. Now there are certain, special incidents that can happen, whatever precautions we may take in the laboratory. That is, certain spills can occur. Those spills, again, they have to be divided based on the risk involved, whether they are the low risk or moderate risk or high risk. If it is low risk, like there is a spill of blood on the bench, it is a low risk. So we have to divide based on the risk. And we have to take precautions, how to manage this bill as well. We have to again, document whatever we have done to contain that spill. So, what is the algorithm of managing this spill? It's simple that we have to cordon the area. We should not allow anyone to enter wherever the spill has occurred. And if there is an aerosol production, especially if there is a spill in the centrifuge that will lead to aerosol production, we should at least allow 15 to 30 minutes of settling time of that aerosol. We should don ourselves with the personal protective equipment. Then only, do any management of the spill. And we should put the absorbent material on the spill. We should put the disinfectant from periphery to inwards. And then we should do the cleanup. Like we should pick up the absorbent material with the help of forceps and discard it in the yellow bin. So this is what is done. And whenever the spill management is done, it should be documented that the spill has occurred, and these were the corrective action which were taken. Again, this is, I've told you how do we manage the spill. This is a special scenario where the aerosol production occurs, especially if there is a centrifuge related spill. We should allow that aerosol to settle mainly for 30 minutes, and then only we should open the centrifuge and clean the buckets and the centrifuge from inside. Also, as I told you, we should treat each and every patient, we should treat each and every sample as potentially infectious. No matter what the diagnosis is, whether the pathogen is present or not, because if we treat that, we'll definitely take precautions. We'll take the preventive measures, and we will follow the good laboratory practices so that infection doesn't occur actually. So what are the samples which are the source of infection? They can be the blood or semen or vagina or CSF fluids. So these are the high risk fluids which must be considered as potentially infectious all the time. And while dealing with it, we should take all the universal precautions. So universal precautions again. So they are the standard practices which we are already practicing in the laboratory. Start with the hand hygiene. As I told you, even after taking out the gloves, we should wash our hands. And if we come in contact with any sample, we should wash our hands. If we touch the patient, we should wash our hands. So hand hygiene is the most important thing. Personal protective equipment, again, based on the risk which is involved, we should use the lab coat, gloves, eye, cover, eye protection, and 95 masks, based on the risk which is involved and the pathogen which we are dealing with. Again, so if we are dealing with a sharp, again, what precautions which we can take while dealing with the sharps? We should not recap the sharp, we should immediately dispose it. And if there is any needle stick injury, we should document it. And we should always try to find out whether that sample was infectious or not. And we should have a post-exposure prophylaxis also available. And especially for hepatitis B virus, we can have the vaccination also available. And tetanus vaccine is also available. That should also be given to all the healthcare workers. While specimen handling or sample handling, as I have told you, we should always carry the specimen in a leak-proof bag. There should be a biohazard, signage over the specimen carrying bag. And before, giving it to any biomedical waste agency, we should always segregate and disinfect the waste so that it should not become a source of infection or for the outbreaks in the public health system. Um, Again, exposure management, special exposure management. If there is a skin involved, we should wash the skin. If the eye is involved, we should have eye wash in place. You know, in the medical laboratory, it is very much required because there can be a splash to the eye. So eye wash should always be in place, and it should be accessible to the laboratory person working in the laboratory. And we should always report such incidents, and we should always have the corrective action in place. Vaccination, as I told you, tetanus and hepatitis B vaccine, that is mandatory. But influenza can also be taken because it's a seasonal thing. It can also lead to the hospital acquired infection or laboratory acquired infection. um, Okay, so what happens that when we do not follow these guidelines, say the biosafety guidelines, and here we need to understand that biosafety is not only for the personnel doing the work, it is for the quality assurance as well. How? Because we are dealing with a sample. If we do not have the safety guidelines in place, if we do not put on the gloves, if we move our hands swiftly, if we do not have the biosafety cabinet in place, it will lead to cross contamination of the sample. Then that will lead to wrong reporting, wrong decisions, wrong treatment, and hence the patient would be affected. So the quality assurance is also affected by not following the good practices and not having biosafety policy in place. That is why they are integrated, and we must follow good laboratory practices. Now, ICMR has given, 8 pillars of good laboratory practices, and it has given the framework that how all laboratories should work, so that it is not only creating the safe environment for the personnel or the laboratory personnel working in the laboratory, but also giving us the accurate reports, so that there should be a trust in the diagnostics. So we should have, first of all, the proper management and organizational policy, and we should have a proper infrastructure in place. The personals who are doing the work should be competent enough. They should be trained, and they should have the proper required degree. The sample management, right, starting from pre-analytical to post-analytical, that is the waste disposal, should be followed in a proper way. And we should have the required equipments and the reagents, which are according to the scope and the tests which that laboratory is performing. Then there should be quality assurance in place. That means the internal quality and the external proficiency testing should be done in the laboratory, so that quality work is and the quality reports are given. Biosafety and waste management protocols should be followed. Proper SOPs and proper record the documentation of, say, the incident, as I told you, this should be done. And definitely giving the good reports, so that patients' welfare and patient-centric reports and good quality work is done. How can we do that basically? So biosafety, as we have seen that it is integrated with the quality work as well for the microbiology laboratory. We must know that there are accreditation body nationally which can certify that yes, you have the compliance in place and you are doing the good work, because they have the total quality management systems. They have the checklist, and it is according to that checklist the quality work should be done, and the documentation should be done in the laboratory. And then they can certify, yes, that okay, all the quality work and all the quality assurance programs participation is there in the laboratory. And if there is any non-conformity which is observed during the audits, then those non-conformities should definitely have the corrective action and the preventive action in place. So definitely the accreditation accreditation bodies are there. NABL is one of them. We have the proficiency testing, as I told you, EQUAS, that is quality assurance program, because that is going to compare our result with the other laboratories, and we would definitely know that whether we are working at par with other laboratories, and that will lead to standardization of the reports which are being given to the patients. And two reports from the two laboratories can definitely be compared if we are following this EQUAS quality assurance program. And definitely good laboratory practices, the guidelines which are given by ICMR, that should be done, because that leads to a safe environment, that leads to good report and a quality work. So, what are the key takeaways? The key takeaways are that, first of all, biosafety laboratory 2. These are the most common laboratories, microbiology laboratories, which are there in the hospitals, as well as which are there in the medical laboratories, which are handling most of the work, and which are dealing with the pathogens which have the moderate risk, say the HIV, hepatitis B virus, salmonella. And these pathogens have got the vaccines available, they have the treatment available. We can definitely have the containment and the control in place, and we can stop the spread of this. And whatever the guidelines are given by WHO, these are risk based. We must understand that a person performing a test, if that person is not trained, then the risk of a moderate pathogen can step high. There would be definitely that can lead to even the outbreaks. Then we must follow the standard practices, right? Starting from hand hygiene to personal protective equipment. We should always follow the waste discarding guidelines, and we should have the segregation and decontamination of waste in place. If there is any incident, say the spill, we should know how to manage it, and we should always document it. And we should also try to have such incidents less in number, and this can easily be done by training the personnels. We should consider all the samples as potentially infectious, and that is why we should always have the universal precautions in place, and we should always have the accreditation or the quality improvement plan. We should have a quality policy, and we should participate in the external quality assurance program, so that we can give quality reports to the patients, and whatever the treatment they are getting, that should be based on the right report. Thank you so much for listening to our presentation. And Dr. Mahtab, if you have any comments.
Thank you so much, Dr. Manisha, for putting up all, uh, what should I say, the importance of diagnostic work for a healthcare facility, all, safe practices which are important for not only the healthcare providers and patients, but environment also. And, putting forward all, guidelines and requisite, standards for waste management, and then all related work in a laboratory. But before I open the session for question answers, just a little a couple of queries from my side first, and then we'll open it for all. Like, you mentioned everything which can go wrong if the lab work is wrong, or we are not doing in a right way with safety and all protocols. But I am wondering how can this laboratory work impact the better outcome of patients everywhere, or all in a in total as a healthcare facility. The question one. And the second one, if somebody like me wants to go for some accreditation, what could be the tips for us from your sides?
Right. So let's start with the second question first, because what I feel that the quality work, if it is required, it would definitely need some sort of certification, accreditation. So we have the accreditation body like NABL, as I told you, for the laboratory. They have entry level as well as the advanced level in place, and that accreditation, even the smallest lab with a single test or very limited scope, they can get accredited. So what basic requirements would be? They should fill all the compliances. They should have quality manual in place. They should have SOPs in place. They should participate in the external quality assurance programs. They should run the internal QCs daily. And once they receive this entry level thing, then they can have the advanced internal audits, continuous improvement programs, audits, and the management review in place. And this would lead to continuous improvement of the processes which they have already set in. So I would say that if you have the small laboratory, if your sample load is low, even if you have a semi-automatic analyzer, you can definitely apply for the entry level. Then you can definitely increase your scope. You can increase the continuous improvement plan, and you can have the automatic equipments in your laboratory once you have more sample load, and then you can push to the other level. This is one. Then secondly, if we talk about the quality in the whole work, I think the quality work starts from the personal. A personal should be well trained, because whatever the framework we make for the total quality management, that framework has to be continuously audited. That has to be continuously data driven. Suppose I just tell you that if we are running the internal QCs, and if those internal QCs have got the outliers, and we are seeing that okay, there is a trend in that outlier, and that outlier is being done at a particular time when somebody maybe some personnel is there in the laboratory working, then we may deduce that that person is not trained to work properly, and we can train that person. Or if we find that if there is an outlier in the internal QCs, if the equipment is not working properly, then we can definitely have the preventive maintenance of the equipment. So these are the trend analysis which we can definitely do if we are running the internal QCs, and we can definitely improve. This is a part of our continuous improvement plan. We can definitely improve our daily work. And once the framework is formed, then we have to audit ourselves. We have to find out the gaps. We have to continuously improve to have the quality, work. This is the only way to do it. And I think the personnel, the processes, the organization, the quality policy, these are the center to every work that is being done in the diagnostic laboratory.
Yeah, but again, I must remind my first question about, we talked about all the, ill effects of,
Right.
if we are not doing, good work in the lab. But what about the, better outcomes? How, laboratory works, support us to have better patient outcomes? And that was my first question.
Okay, so better patient outcomes, I think, starts with the quality itself. All right. So for that, as I told you, the internal QCs are the best way to find that whether our machines are working properly, our processes are in place, the personnel is well trained or not. So that is the way of finding out the outliers. That is the way of finding out the the method which we are doing. Even we can do the method validation, the equipment validation, if that is installed newly in the laboratory. And whatever we are doing in the lab, we have to continuously monitor it. If there is any outlier in what we are doing, then we have to definitely correct it and do the corrective and preventive action. Why I'm emphasizing here on quality is that whatever we are doing, that will ultimately affect the patient's outcome. Because if we are not generating the good report, because of the outliers or because of the any non-quality work, then that will affect the decision making of the treating clinician. If our reports are not correct, if they're not comparable to the external any other laboratory following all the quality guidelines and good practices, then definitely patients would be affected, because ultimately our reporting would not be okay. So this is the quality is the only way to have standardized reporting, and so that any report which is generated, say in India, or any international report generated any other in the all over the world, they should be compared.
Thank you so much. Thank you so much. And uh, let me join all the participants again that we are mid in the celebration of the hand hygiene week. Yesterday we
Yeah.
had the World Hand Hygiene Day, and what a coincidence that we learned so many things from you about maintaining hand hygiene and maintaining the quality and safety work in a lab. So may I request the participants if they have any questions for Dr. Manisha, and or if they can, uh, Dr. Muskan, if you can, check the chat box also whether we have any questions there, or anybody who can, raise their hand or unmute themselves and ask Dr. Manisha directly any questions.
Correct. Thank you so much, Dr. Mehtab. Also, first, I would like to thank Dr. Manisha for that one insightful presentation, ma'am. And I would also like to thank Dr. Mehtab for having an interactive session with Dr. Manisha. I think we have a few questions in the chat box, so I would ask the backend team to display one. So, ma'am, there is a question that how can small labs improve quality with limited sources?
Yeah, so basically that is what is important. They can start with a limited scope, because see, quality means that you have to increase your spending. So you can start with a smaller scope, maybe say a few biochemistry tests and a few hematology tests, and you should have the quality manual in place. The personnel who are doing the tests should be well trained and well qualified, and definitely you should participate in the internal quality assurance program and the EQAS, right? Definitely go in for the accreditations, because that is the way you can improve your the work which you are doing in the lab. That will tell you whether your outliers are. Even the smallest laboratories with the smallest scope can apply for these entry level accreditation.
Thank you so much, ma'am, for that descriptive explanation about how small labs can improve their quality within the limited resources that they have. We also have one more question. Backend team, can we have that on screen? What are the most common mistakes that labs make in quality management? If
So
you could
here I
highlight.
would, yeah, yeah. So non-negotiables would be not participating in the external quality assurance program and not running the QCs. So you should not cut that part at least, because if you don't run internal QCs, you will not get to know that whether your equipment is working properly, whether your reagents are correct or not, they're not expired, they're up to the mark. And so I think please do not cut on running internal QCs.
Correct. Thank you so much, ma'am. We also have one last question that is flashing. Can we have it on screen? What basic checks should every lab do daily?
So basic checks would definitely, as I told you, that we are here to discuss the biosafety. Every process has got, I think, the checklist. So let's describe what we can do for biosafety. For biosafety, as I told you, there are certain standard practices which we should follow. We should follow the hand hygiene. We should restrict the entry into the laboratory, and only the authorized person should, enter the laboratory. Please do not mouth pipette. That is the most dangerous thing which is done in the laboratory. Do not know if there is aerosol generation. Open that sample or the work which we are doing. If there is aerosol generation, do that work in the biosafety cabinet, because aerosol, they are the most common way of acquiring the infection. Even the moderate pathogen can lead to acquiring of infection. And clean your workbench, disinfect the equipments daily. So these are the certain things which we can definitely follow. Waste management should be done. So we have a separate checklist for each and every thing which we do in the laboratory. And for the biosafety, these are the things which are mandatory and should be or should always be done.
Thank you so much, Dr. Manisha, for sharing those clinical facts for improving safety and quality during laboratory purposes. So with that, I think we conclude our today's discussion, and it was a very insightful discussion, ma'am. Thank you so much. Also, I would like to sincerely thank Dr. Mehtab for that interactive discussion. Thank you so much.
Thank you. It was wonderful talking to you, Dr. Muskan and Dr. Mahtab. Thank you. Thank you so much.
We don't have any other questions, right? So let me, have a couple of final words,
Sure.
and then we can wrap up. Like, I fully agree what Dr. Manisha has, told us today about laboratory work. But the key, I think, which have given me an insight, and I usually follow that. First, we have to think that we are not, or we might be not doing all the things right. That we have to, accept first before we go for, improvement in our work. So something, if you are not able to give the right SOPs or protocols, then something wrong is happening. So we should be careful of that. And one message for all participants, that it would be a regular, I think, uh, event in future. So we'll be keeping you informed about our upcoming webinars or upcoming days live sessions. So be in touch, or we'll be informing you. And maybe the next thing we would be discussing about the real topic of quality improvement. How to achieve that, and how important is that? I think that's from me, from my side, Dr. Muskan, and I'll request you to now you can wind up and close the session. Thank you so much.
Thank you so much, Dr. Manisha.